Hey, welcome. I always try and look for a really interesting topic related around the oral microbiome. We've got Dr. Jason Pang, and we have two invited guests. We've got Christina, who is a naturopath, and she's got some amazing insights to share with us and her patient, Lisa Gumanyuk. I had a wonderful case study land on my desk sent to me by Jason a month or two back. But Jason, could you just give some position there? And what we're going to do is just show the power of what you're doing and the impact it's had on these ladies' lives. And I'll just leave it to you.
It's the other side of the dentistry equation, which is really a lot of us are trying to kind of do, especially here in this sort of space. One of the things that we've been trying to do is bring dentistry to the forefront. And so by doing that, we have to communicate with our medical colleagues. So one of my medical colleagues, she does this monthly meetings where she gets people from all allied industries. I attended one of her meetings, met up with Lisa, who became a patient. So been seeing Lisa for a little while, and then with the microscope was able to figure out a couple of things that was happening in her mouth, in her life, and then she was able to really use that to take control of what was going on. And then Christina came into the equation as well, and so I've been referring patients to Christina as well. But I think, Lisa, if you want to sort of show what you've got and maybe share your story, that would be great.
Sure. That kind of concept of connecting from the heart and that emotional, connection, and the reason for that kind of patient care. It's something that I've really felt with Jason, because we met at a practitioner forum. I'm a practitioner as well, and Christina as well. Like, I really do things from the heart. So it's really interesting to see that conversation from a dental perspective. In the work that I do, it is all heart-based, and it's also the work that Christina does, and she's helped and supported me, and now she's on my team because she has a big heart and is really passionate about helping people at that really deep level. So I guess a little bit of a thread through that, and also gives a little bit of context as to the presentation that I'm going to go through and my experience on my oral microbiome journey, because it really is about, it's not just kind of what's on the surface. There's a lot more that kind of, is to do with really, we blend that healthcare. It was really for my healthcare, but also in the context of how I work with clients and how Christina works with clients. And that will make a little bit more sense as I go through. So just a small little history with me, even though I'm the patient here, I'm an integrated practitioner and specialize in supporting people with nervous system regulation, with somatic, so body-based and brain-based retraining for chronic illness and chronic conditions, anxiety, trauma, etc. And so I've had my own challenges with health, with mold and chronic illness, lots of parasites and pathogens over the years. So I'm really passionate about my own health and the health of my clients. And so I blend all of those kind of concepts together. And so in a kind of, I guess, as a little bit of an overview, I started experiencing some fatigue and fog over the period of about 3 months, and it was affecting my day-to-day functioning and my work. So I would kind of say I wasn't overly functioning. I was really, really challenged, and I was trying to figure out what was going on. So I had gut issues, I had brain fog, I had a severe lack of energy, and also I'm trying to piece it together, but I remember having a conversation with Christina, and I said, I've got some suicidal ideation. And it's a really big comment to make. And I'm kind of trying to map it, and we don't have the exact date and time of when that happened. Now, I've had that in the past where I've had a really high pathogenic load. And so I've had some health challenges, but things had improved. I was doing really well, and then my health started to decline. It's like something is really not right here. And if I have suicidal ideation, there's something significantly not right here. And so we were trying a number of things with what we were doing, and we weren't quite getting there. And so what had happened was I went from, cycling, doing like 40 Ks on the bike at home 1 week, 6 Ks a day, to then kind of the next week not being able to cycle at all, and my health declining more and more and more by the week. And so I can't recall if I had the blood test first, but I went to Jason because 3 months prior, I'd had a root canal. And I was then concerned, like it was kind of happened about the same time as the root canal. So I was concerned, are my symptoms that are coming on to do with the root canal? Because that kind of seems to be the only link. Like I don't understand what's happening. So we did a cone beam scan, had a look at the detail, and all of that was ruled out. There was a slight infection, but that had significantly improved since 12 months prior. I went to Jason for a clean and kind of said, yes, I really need to, like, can we check the root canal? And so we did the clean. There was kind of some more bleeding and things, which were a little bit more abnormal from Jason's perspective. And then he did an oral microbiome swab. And so he said there's some really quite high levels of amoebas. And it was really interesting because actually I did have a blood test the month prior. So I do blood tests every single month to see what's happening because I've made some quite significant nutritional changes. And before it was identified that I had the amoebas, I had a really low white blood cell count and low neutrophils, which was really unusual for me and for my pattern. So it was highlighting there was some kind of infection. I had elevated levels of urea, and urea is an indication of what's happening in the gut and gut health. I had some thyroid, I get my thyroid checked because it's been out of range, it's been coming back into range, and it was in range, and then all of a sudden it wasn't, which is also kind of indicative of how I was feeling, like something, and I just kept thinking like there's something that is really not right. There is something that is really not right. So there were some blood markers, then obviously saw Jason and said, yep, there's some amoebas happening.
So this is a still image of the live biofilm that I saw of Lisa. So I do have a video, but I mean, this it might be playing, is it?
This is the video.
It moves very, very slowly, but what you can see here, yeah. So what you can see here is really what should be, or kind of what looks like white blood cells, but you can see because of the elongation, because of the way it's slightly moving, that it's actually not white blood cells, and they're actually amoeba. So this is a very, very high load of amoeba, and so just brought that to her attention.
Yep. And it was interesting because obviously, a week or so prior, I had the blood test where I had low white blood cells. So Jason said, oh, it looks like there's, like white blood cells in your mouth. And I was like, this is a bit odd because I have low white blood cells. Why are they all in my mouth? And so Jason had then recommended a protocol. So he had recommended antibiotics being metronidazole and amoxicillin, ozone mouthwash and gargle, Colgate peroxyl mouthwash and gargle, flossing, changing my toothbrush. I've got a dental plate, so cleaning that more frequently, which I've had for years, and improving some of my cleaning strategies. And so when I heard this, I've had, as I mentioned, chronic health challenges. I don't always respond very well to pharmaceutical medications. And so the thought of taking antibiotics for me was like, I don't know whether I'm actually going to be able to tolerate taking antibiotics. So I said to Jason, thanks, I'll take that on board and then I'll do some research and see if there's, something that I can do that might be a little bit more natural to support the journey. And so I'll share with you Zach Bush. Zach Bush was an integrative doctor, really amazing. I've got the link to where he spoke about this and some information about Zach Bush. But he really is, I guess, to some extent about like preventative medicine, but also internal medicine. And so he also kind of changed his direction because of what he was seeing. So he made some really interesting comments in an interview. And he said, one course of antibiotics increases your rate of depression by about 25% in the following 12 months. One course of antibiotics has a 25% increase in your risk of major depression. One course of antibiotics, there's a 19% increase in anxiety attack and panic disorder. If you have 2 courses of antibiotics, because of the disruption, and the color bar and the quality in the gut, you've now wiped out the gut flora with the antibiotics, which means that you've now lost the restore-like molecules that are doing this wireless communication network, which means that you're now leaking across the membrane, which means that you're now overinflamed there. And then there's the neurological system is starting to get a hit as the blood-brain barrier starts to fail. And so he said, that's one course of antibiotics. If you take up to 2 courses or above, then we get a 60% increase in the likelihood of major depression within a year and multiple courses of antibiotics. And we know there's also antibiotic resistance, etc. So, I see a lot of challenges with my clients who have had antibiotics or medications. And I've got a client, for example, who's down to one type of water and 2 foods and has mast cell activation syndrome. So I personally also get some really complex clients, but want to do the best for me. So I took all of that on board and did some research. And so I started with a herbal protocol, and Christina's going to go through the detail of that, and started taking 5 ml a day. So after the diagnosis or the findings from Jason, my husband went and got tested the next day, and he also had amoebas. My husband is a little bit more resilient in health than what I am. So I started taking 5 ml of the antimicrobials, and he started taking 10 ml per day. I have converted to a carnivore diet. So that is just animal-based products in terms of food. And I've been doing that for 5 months. It is now 10 months at the end of this month that I'll be carnivore. So one of the things to support my own gut flora with eating carnivore is homemade kefir. So I don't do too well on cow's dairy, but I do really well on goat's dairy. So start off really slow. Kefir is amazing for gut health, and Christina will share some of that, and also kind of swished it around in my mouth because there's so many probiotics in kefir. So in terms of oral hygiene, I started flossing more. I kind of laxed a little bit, and maybe that's where the amoeba infection had come from. So flossing twice a day religiously. I switched my toothpaste. So the brushing solution, which I've got a link to here and on the next slide, is a liquid solution, and it's got some more information on the next slide. I started using that twice a day as my brushing solution. And I applied Perio Mix a few times a week. We used an ozone machine, just a really, really cheap one, probably not medical grade, but we used that a few times a week initially. I'd soak my plate, which I wasn't doing previously, in like a Sterident capsule, and did that every single day, and then obviously cleaned it afterwards. I was always using an electric toothbrush, but changed the heads more regularly, kind of every 2 weeks once I had the infection. Did some more tongue scraping and had an electric water flosser that I used a few times a week. So for what I say here, for approximately 1 to 2 weeks. So when I started the antimicrobial herbal protocol, I didn't feel well for about 1 to 2 weeks. I was significantly tired. I'd kind of wake up, do some things in the morning. I'm like, I'm so tired. I'd go for a walk and I was falling asleep. So here are the products that I use. So the brushing solution, as I mentioned, is a liquid, which is hydrogen peroxide based with clove, peppermint, aloe vera. And I looked at this product obviously versus the peroxole. And again, I want to try and eliminate as many kind of, chemicals or artificial additives and chemicals as possible, and do things as natural as possible. If I got to the stage where I needed to do something that had, higher strength, I would look at that. And Jason and I had spoken about that initially. I thought, I'll give this a go. If it doesn't work, or I'll come back and we'll retest, then, I can look at, do I need to take the pharmaceuticals, or, do I need to look at other things? And then the Perio Mix is a bicarb soda with canning and pickling salt with essential oil of peppermint. And so that's a powder that you kind of pad onto and kind of leave near the teeth and in the gums. Not overly enjoyable, but I did that often at night, occasionally. So my results, so I think it was after about the 5 weeks after that initial clean and the initial findings. So I had a significant boost in energy at the end of 3 weeks, which continued. And I had written this and created this at week 5. Feeling better. I actually had more energy than I did prior to the fatigue and the brain fog. So obviously I saw Jason, and I'll show some photos of the after, what that looked like. And then so we spoke about, I did the oral microbiome testing, and we'll see that was clear. So I was actually surprised that in such a short period of time from doing the cleaning and from the antimicrobials that my energy levels improved and I was feeling better, and that there were actually no antimicrobials kind of present. And I thought there would be at that time. And I thought, well, I haven't done antibiotics and I'm doing the antimicrobials, and I don't know if this is really going to have the results, but it did. So yeah, my energies just kind of actually skyrocketed. So I have some blood results that show a few things, and this is kind of a bit of a summary of that. So I had obviously the root canal. We were expecting with the result of the root canal that there would show some inflammation in my blood results as a result of that healing process. And it would take some time to balance. And we kind of saw a bit of that. Obviously, we weren't necessarily expecting a high ESR marker, which is a marker of inflammation, and higher homocysteine levels. So yes, they kind of homocysteine rose as a result of the root canal, but then they got better and then they didn't. So it's like there was a few markers that are like something is not quite right after the period of time of having the root canal and things kind of stabilizing and then kind of getting, health and markers declining again. So as I mentioned, the urea was out of sync and increasing, and my thyroid, which had started to become in balance, went out of balance again, which was an indication that there's some kind of inflammatory process happening and there's a strain on detoxification pathways within my body. So we said, we'll continue to, after this, track the white blood cells, the thyroid and the homocysteine, etc. So this was a little bit of an overview, a little bit kind of technical here, but we see like pre-root canal, white blood cells were all looking good. Urea was within range. Thyroid was almost there, Christina. Yep. Post-root canal, I didn't have the white blood cells done, but we could see that the thyroid again and homocysteine were increasing, kind of going out of range, indicating some inflammation, which was to be expected as it can take some time, as we said, to rebalance. And then ESR, inflammatory marker, and then the white blood cells going out of balance, so being quite low. The urea, gut flora, indication out of range. We kind of want it to be about 4.5. And obviously it's increasing, like, well, what's happening? What's happening here? Interestingly, we said my thyroid was in range. So that was probably as a result of things coming to balance after the root canal, but the homocysteine was still increasing, which was kind of a little bit at odds. We've got the gut flora and the homocysteine, like something's not right. And I tested because I was feeling unwell. I then did another checkup, and obviously I was a few weeks into maybe I just started the antimicrobial protocol, but the white blood cells obviously were still not great, and you can live in the lag for a little bit. So you might kind of start to feel better, or things might be working, but it can take a little bit of time for things to rebalance. Gut flora started to rebalance. Thyroid was still, not happy as a result of what I had been through with amoebas. And homocysteine obviously started coming down, etc. So yeah, still, TSH again, thyroid coming kind of back in range a little bit and starting to decline. I've had some tests since then, but unfortunately, I ended up with a flu, which then has obviously kind of skewed the results going forward. So that is those, and these are the results afterwards. Did you want to talk through this, Jason?
This is Lisa after, so you can just very, very low levels of bacteria there in the background. That's mostly what you're seeing there is food and epithelial cells. So that's not a problem, or just breakdown of products, so plaque as such, as opposed to biofilm. Just low levels and no white blood cells, no amoeba that you can see on the screen, which is what we want. So quite a big difference. So just going to say, so with amoeba, you obviously can't tell what type of amoeba it is. I mean, there are lots of different amoeba. There are ones that are definitely pathogenic. We can't say that at all about what we're seeing here. But if the amoeba are around, then it's going to eat the white blood cells, not allow the body to have the same kind of immune response, and then allows bacteria and other things to overgrow and then just put things out of whack, which is what she saw.
And my experience as well. And so we kind of spoke about, the next steps would have been like, retesting the blood cells, the neutrophils, urea, homocysteine, ESR, zinc, copper, etc., because the amoebas impact the zinc. My zinc and copper are now within range and nicely balanced. Jason had recommended, because the results were successful, or obviously we could see the low pathogenic load, to then come back in 4 months to retest and for a clean, which I think I've got maybe another month to go. And then, there's always the potential, to have a look for further oral microbiome testing with a swab and doing a panel through somewhere like Naturopath, which kind of has some more information about the type of a potential infection. But because we kind of see that visibly, from my perspective, there isn't really a need to do that because I'm feeling better, and obviously we can see visually from the results. So that's it from me.
Thanks so much, Lisa. I'm just blown away at your level of knowledge, which is great, and I'm so excited, I guess. Communities coming together to actually understand what each other do. I always go on about us working in silos and not really understanding what we do, and this is just brilliant. Thank you so much for your vulnerability to share your journey. Christina, can you explain how you came into this mix where you were already a friend and was Lisa a client? And, obviously I didn't understand the impact that antibiotics had on depression, and, I do get the whole gut flora thing, but this is just, highlighted to me that I have to move to Sydney and become your clients. Anyway.
So Lisa was a patient of mine. We'd been working together for about 5 months before this process had actually happened. And so when she came back from the dentist and said, I've got an amoeba and maybe we should do some antibiotics, we're both in that situation of freaking out a little bit, simply because we have, Lisa has got a history of chronic illness. And so, we're starting to see this progression of her getting better. And the last thing we want is to actually wipe out her microbiome and actually have to start from scratch or have her react to those things and actually then try and get her health back up to par to where it was previously. And so we both went in with a little bit of trepidation in the sense of like, let's give this 4 weeks. That was our proviso. We'll try some antimicrobials. We'll give it 4 weeks. And if you don't get the results or things aren't moving in the right direction, we can always then opt in for those antibiotics. And so Lisa was happy with that approach. I was happy with that approach, which we were looking at her overall health for in that regard of looking at what we could do. And so this in particular is Lisa's herbal formula. Now, the herbal formula will need to be different for everybody. And, you can see in the notes there that Lisa has some issues with garlic. So garlic is sometimes an antimicrobial that you can use. We could not use that for her. There were other considerations in regards to Lisa's situation as well. So as we move through some of the slides, we'll talk about, different herbs that you might use for different things. And so, like I said, every client is different. And so Lisa's husband also had this amoeba as well. He is not necessarily following the same dietary protocol that Lisa is. So he needs a higher dose, plus it's taking a little bit longer for him to actually get those results. So when we have the opportunity to do all-inclusiveness of like making sure the food that's going in their mouth is really good and healthy for them, it aids in the improvement of the outcomes of this. And so every client is going to be different. And when I'm looking at creating a herbal formula for them, I have to bring in some certain considerations, like what is their current state of health like? So if someone like Lisa, who's had a history of chronic health issues, I'm not going to go in with really heavy, hard-hitting herbs. Whereas somebody who is more robust, maybe doesn't have any health issues, maybe is a little bit younger as well, we can use some of the more high potency herbs with those people. Medication is also going to be a consideration as well, because some of these herbs may have some contraindications for particular types of medication that people are on. So that's also going to influence my decision about what herbs would be appropriate for each individual. And then, of course, we're going to look at the state of their microbiome. So we're looking at blood tests. We might look at other health indicators, like generally I'll have patients send me a photo of their tongue so that I can have a look at like what might actually be growing and breeding and living on their tongue to help me consider what sort of herbs might be appropriate for them as well. So for example, they might have something like Helicobacter pylori. In that case, I'm going to select different herbs that will help target that versus somebody who doesn't have those. And then different herbs are more appropriate for different people as well as different dosages. So again, Lisa is on half the dose of what her husband has been on, and that's partly because they've got very different health situation and different lifestyles as well. So when I'm making up the herbal mixes, I'm looking at a whole bunch of different things. So I'm looking at the antimicrobials, antifungals, antiprozoa, antiparasitic sort of category. I'm looking at also helping them through the detoxification process of that. So in Lisa's situation, she has MTHFR as well, which decreases the ability for the liver to be able to do some of the detoxification processes, which is why we were looking specifically at homocysteine and tracking her homocysteine levels to make sure that she was coping with some of the the things that would be used in those dental procedures, like an anesthetic, etc. And so I'm going to put in hepatoprotective herbs that are designed to help support the liver, do that process of detoxification, as well as protecting the cells of the liver as it goes through that. And then we're looking at immune support and modulation, because ideally we want their own immune system to actually come into action and take over some of those roles as well. And then microbiome support. So one of the things I'll talk about is green tea and how protective that can be to help support some of the challenges that might happen when we put in antifungals and we put in antiparasitics and so on. We want to protect the microbiome that's currently digestive support as well as nervous system stuff. So we want to nourish the nervous system because parasites and amoebas and all of those microbes interact with the nervous system. And so we want to nourish it and make sure it's nice and strong. And then the last consideration for me is taste, because some herbs taste vile. And so I'm going to take that into consideration when I'm selecting those herbs as well, something that people can take. So it's about getting that right balance for the right individual. So if you jump back to that, yep. So what I've done here is I've just highlighted a couple of the more prominent herbs. So these are all antimicrobials, bacterial, parasitic type of herbs. But some of the ones that are really specifically beneficial are things like cloves. Golden seal itself has been known in some lab tests to be able to actually work on golden seal. So it's one of the great herbs that we've got golden seal is really good for correcting things like golden staph because of how beautiful it does that job. Green tea, oregano, Paul Diaco, and wormwood are some of the more prominent ones that I'm going to use in a formula. But again, it's all going to be individually based on the health of the individual, what sort of lifestyle they've actually got as to what would be appropriate for them. The next one is those hepatoprotective herbs. Generally speaking, the top one on the list is going to be St. Mary's thistle because of its hepatoprotective nature. And Schisandra is another really good herb to actually help the liver do the processes of detoxification when it comes to medication. So those two are usually the prominent ones that I would put in a mix. Immune supportive ones, echinacea is an immune modulator. So if the immune system is over functioning, it will help calm it down. If it is under functioning, it helps lifts it up. So it's a really great one from that perspective. We've got some beautiful mushrooms like reishi and shiitake that are great for that. And then we have things like that Korean ginseng or Siberian ginseng. Now, both of those would have been too much for Lisa's system to cope with, so they weren't in her formula. But for somebody who's younger and maybe more robust and doesn't have chronic health issues, then that would be something that I would consider adding into that formula as well. And then the nervine herbs, again, we're going to select them based on the individual. Green oats actually shows itself to be quite beneficial when it comes to supporting the nervous system. And again, so John's wort, for example, is quite good for people who they're predisposed to anxiety and depression. And so we might actually include that into one of those herbal formulas as well. So again, it's based on what's happening for the individual and what we actually need to help support them with. And then that last goal, we really want to protect the microbiome. And so green tea itself has demonstrated in a whole bunch of different studies to be protective of the epithelial tissue, as well as the microbes that are living in there. So adding that to the mix is quite good, and it was in Lisa's mix. And then probiotics. So ideally, my original approach is to go with food as much as we possibly can. And so we're going to use things like milk kefir, which has, a homemade milk kefir can have anywhere between 80 to 120 different strands of microbes, whereas a store-bought probiotic can have anywhere between 4 to maybe 12 is what you're going to get from a chemist. Some of our prescription ones, you can get up to 20. So milk kefir will blow everything else out of the water in regards to how many different strands of bacteria we can get in there to help balance the microbes. And then milk kefir and sauerkraut where possible for some people. And for some people, they can't tolerate any of those foods. And that's when we'll look for those probiotics. That would actually be another way of bringing in good microbes for them. That's pretty much me. If you want to ask any questions, please feel free.
That's awesome, Christina and Lisa. Would you have ever thought, just a personal question, that a dentist could be involved so intricately in the treatment of your clients? It's a question from me.
Well, the answer to that question is 100% yes. I have worked with myotherapists and other dentists previously, and I think that dentistry is really an overlooked industry when it comes to the whole general well-being of an individual, because what goes in their mouth is one of the biggest things that can change their body. And so for me, I work with a lot of patients that have what's called MTHFR. And for them, they might have dental structures that are different. Their palate might be higher. They might be mouth breathers, all of which is going to change the microbial balance of their mouth. So if you're breathing through your mouth all of the time, then the microbes that live in there are more pathogenic than those that have the ability to breathe through their nose. And so dentistry for me is really an underlooked at industry when it comes to the overall healthcare of an individual. Like, we know that the number one cause of heart disease is actually dental infections. And so dentists play a major role in actually the long-term well-being of patients.
And probably I should have changed my question to the dentist in the room as well. I think dentists, our profession, doesn't understand how intricately we can be involved in the overall health of a human entire body. We focus so much on the white, and then a few of us focus on the pink as well. But yeah, beyond that, it's not. Jason, girls, where are you? Are you both in Sydney? Yes, Lisa?
Yeah, Susan, I just wanted to say, I literally walked out of Jason's clinic that day, and I was walking across the road. I think I called someone, and it could have even been Christina. And I said, the words were, I feel like I've dodged a bullet, because I was so unwell at the time. And I thought, if it wasn't I was really thinking it was going to be the root canal. If it's not my root canal, then what on earth is this? And we've looked at so many different things. So it was literally, I felt like someone was clearly looking out for me and watching out for me, because it probably would have been months and months and months before I got a diagnosis or a path forward. So I was so grateful for Jason. So, as coming in from a patient perspective, yeah, really amazing. And so many practices don't do that. I've been to a few others for different reasons, and they didn't do any testing. And actually, I had my plate tested a few weeks prior, and they said, your hygiene's probably not so good. And that was it. And there would have been the potential for it to be tested at that point in time. So then my health wouldn't have declined as much, but it's obviously not a service that they offered. So I'm really, really grateful for Jason in that regard.
Look, I'm a universe believer that the universe was at play there, and it was, it's serendipity. I don't know how many dentists in Sydney, perhaps 3, that might even do this kind of work, which is why, it's why talking about this so often is so, so important. And to everyone in the room, I know we're preaching to the converted here, because you are all members of this community of microscopic protocol. And, I'm just learning more and more every day. So, ladies, thank you so much.
Thank you so much, Lisa and Christina, for that. I mean, it is really good to see the perspective of other medical practitioners and how they would sort of almost treat the same sort of problem and deal with it in a different way. I mean, the level of knowledge we as dentists need to improve in terms of like what we can use and the herbals that we can use. And everybody is different. I'm drinking green tea at the moment, which is great. And Lisa spoke about the carnivore diet, and I know we have at least one vegan on the call. So everybody is different. And look, the majority of people can tolerate a certain amount of conventional antibiotics as well. But yeah, definitely, more and more of my clients are asking about the herbal antimicrobials, which is why I've been sending quite a few to Christina. I hope they actually come and do talk to you.
Ladies, Lisa, Christina, and everyone in the room, thank you so much for your input. And we'll see you all soon. Thanks, Jason.
Thanks, Sue. See you, everyone.